everyone, my name is Laura Chung Reed, Public Health Inspector based at the Betheltown Health Center. My topic for today will be on personal hygiene. What is personal hygiene? Personal hygiene is the basic concept of cleaning, grooming, and caring for our bodies. Maintaining a high level of personal hygiene will help to increase self-esteem and confidence while minimizing the chances of developing imperfections. Effects of poor personal hygiene. Poor personal hygiene is the failure to maintain a good personal hygiene. This may increase your risk of getting an infection or illness. The effects of poor personal hygiene are numerous. Social embarrassment is the most common. Many people would rather alienate themselves from someone who has bad personal hygiene than to tell them how they could improve. Here are some examples of poor personal hygiene practices. 1. Improper brushing of teeth or no brushing of teeth. 2. Dirty hands. 3. Infrequent use of deodorant or no use at all. 4. Dirty hair and nails. 5. Improper hand washing. 6. Dirty clothes. 7. Infected hand wounds. 8. Excessive talking over food. 9. Lack of bathing or infrequent bathing. And 10. Failure to wash hair. We will now proceed to hygiene basics. First, let us start with the head. Head and hair hygiene. Wash hair twice a week using a shampoo of your choice. Rinse well and dry your hair after wash. Hair hygiene. Use damp cloth to clean inside and outside the ear and avoid sticking a cotton swab into the ear canal, as this can push earwax further into the canal or damage the inner ear. Genital hygiene. For females, the external part of the vagina, the labia, should be cleaned twice a day. Wash from back to avoid bacteria from the anus from coming in contact with the vagina. Uncircumcised men should ensure the head of the penis is clean, so pull back and wash gently. Skin hygiene. Bathing daily helps to prevent and reduce skin infection. Secondly, don't bleach your skin. It can be considered a form of poor personal hygiene. It can cause skin cancer, liver failure, and other forms of skin-related infections. hygiene. Brushing one's teeth daily helps to prevent bad breath or halitosis, dental cavities, gingivitis, and maintain good general oral care. The most important factor in oral hygiene is prevention. By ensuring good practices are exercised regularly for just a few minutes a day, you can help to avoid oral pain, increase confidence, and potentially expensive treatments. Hand washing is a critical part of good personal hygiene practices. Here are 9 steps that you should take when washing your hands. Number 1. Soap and rinse your hands. Number 2. Soap and rinse the tap. Number 3. Soap hands. Number 4. Lather. Number 5. Brush and clean your nails. Number 6. Rinse hands. Number 7. Examine hands. Number 8. Dry hands. And number 9. Dispose of paper towel. Good hand washing helps to remove germs, contaminants, and chemicals. Occasions on which we must wash our hands. 1. After using the toilet, after handling raw meat, fish or poultry, after handling garbage or dirty dishes, after changing the baby or attending to the sick, after sneezing, coughing or blowing the nose, and after handling animals or using chemicals. It is imperative to note that the first step in taking care of the environment is taking care of ourselves. This is because a clean person will not feel comfortable in a dirty environment, and when we take care of our environment, it in turn will take care of us.
In this video, we will explain how to brush your teeth. Remember to use a medium toothbrush, not a hard brush. Hard bristles cause abrasion of the enamel and recession of the gum line. We will explain how to brush, floss, and complete oral hygiene. Doctors recommend dividing the mouth into 4 parts called quadrants. Brush your teeth 1 quadrant at a time. Remember, use just enough toothpaste, not too much, to avoid gagging and noise in the mouth. Start with the upper quadrants, 1 and 2. Remember to brush 1 quadrant at a time. Start with the facial surface. Start at the back. Start at the gum line in the direction of the arrow. Go down toward the lingual surface of the teeth. Remember to brush each tooth 3 times. 1, 2, 3. Move over each tooth from back to front. Go all the way around both quadrants. Now we'll move to the lingual side and the palate. Start on the underside, start at the gum line, brush down toward the lingual surface of the teeth. For molars and premolars, when you get to canines and incisors, brush vertically as shown in the video. Now we'll brush the occlusal surface. Take your toothbrush, run it in the direction of the arrow, back and forth as shown. Do the same for both quadrants. Now we'll move to the bottom, quadrants 3 and 4. Starting just as the upper quadrant on the facial side. We're going to start at the gum line, brush in the direction of the arrow. Remember to brush each tooth 3 times. Remember to brush behind that back tooth to make sure you get everything. Always open your mouth when you brush your teeth. Brush all the way around both quadrants. Moving to the lingual surface, start at the gum line, brush up toward the occlusal surface of the teeth. For molars and premolars, once you get to canines and incisors, remember to turn your toothbrush vertically and brush each tooth vertically 3 times. Now we'll brush the occlusal surface. Just at the top, you want to run your toothbrush back and forth over the occlusal surface of the teeth. Do the same for both quadrants. Another important part of oral hygiene is cleaning the tongue. Stick your tongue out, run the toothbrush in the direction of the arrow, starting back to front. Remember to pick your toothbrush up and start back to front once again. If your toothbrush looks like this, you need a new one. You should have a new toothbrush every 2 to 3 months.